Good evening, everyone. It is Dr. Swiner. Hello. How are y'all doing? Welcome to my new page. This is the real Doc Swiner on Instagram, and we're doing our first live chat here with my good friend and soror and colleague, Dr. Cheryl Woods Gascombe. Hey, welcome. If you were following me over, hey, how are you? If you were following me over at Doc Swiner, it got hacked a couple of weeks ago, so this is now the new real page. Hey, Annabelle, nice to see you. I see Dr. Cheryl is coming on, so y'all come on in the room. Tell your friends to come on. Your stories. Invite your friends. Hello, Arthur Myers. Hello.
Hi,
Yes, how are you?
how are you?
Welcome to the real Doc Swiner.
Glad to be with the real Dot Swiner.
Such a headache. Such a headache. Social media is both a blessing and a curse. I mean, it's crazy.
Yes, it is.
Yes.
Hey, Dr. Swiner.
What'd you say?
I said it's great to see you. Let me turn my
Good
volume.
to see you. I know it's good to see you too. And I see some of our friends joining. I'm so glad that you all got the message and you're here. And hopefully you're, telling your friends and inviting your folks. Hi, Michelle Sadler. Hi, 8046. I see our friends here. So I was just sharing that, this is the new page. So welcome to this. I got hacked probably about 2 weeks ago,
Mhm.
and that was fun. So
That just
here
means
we are.
that you're extremely popular.
Oh, is that what it is? Okay.
Uh,
Not that I screwed up my password and then it was too late. It's not that. Okay.
and feel great. Um, and thank you for having me.
Absolutely. So, hey, hello. I see you guys. Hi, The Fit Talk. Hi, Michelle Sadler. Welcome. So if you followed my other page or if you've been following Dr. Cheryl's page, you may have seen our last one that we did probably around what? I can't remember now. A couple of months ago? Can't remember. Right? And we, kind of did some talking about the Superwoman complex, the Black Superwoman syndrome, the Superwoman schema, which is what Dr. Cheryl is a world-renowned expert in. And we talked about the things that we all deal with as women, particularly as women of color, more specifically as Black women, when it comes to being in the workforce like we're doing, or being work from home moms, or being stay at home moms, or single ladies doing all the things and trying to take care of all the people, and then leaving yourself as the last thing that you're even thinking about, I don't want to say last resort, but the last thing on your list to take care of. And that comes with its own mental health, physical health, emotional health, all the all the problems that we treat either as, as a client when you see Dr. Cheryl, or as a patient when you see me in my family medicine clinic. And so we kind of reviewed those things that we have been seeing and talking about and trying to prevent. And we even talked a little bit more specifically about how it can affect heart health during that time. So you may have seen that discussion. And then we were going to follow up with a second discussion, but then it was like a tornado warning or a severe thunderstorm warning. You remember that?
All sheltering in place. Do you hear me clearly?
A little bit, yeah. I think there may be a little bit of a delay, but I can
Okay.
hear you. Mhm.
Okay, great.
Yeah. Yeah, we were sheltering in place. We were like, we were probably going to cancel because you were like, we're in the basement, or we're hiding or something.
Yes,
Yeah.
yes.
Yeah, but go
And
ahead.
goodness, we're safe.
Yes, yes. The storm passed and we're doing great. So this is our reschedule, and then I thought, perfect timing to do it again with, to kind of highlight the new page and get people to kind of come over to the new IG page. So here we are again. And Dr. Cheryl has been doing some new research that I'm very, very, very happy and excited to hear about. I actually saw Carrie Green Scott today in clinic, and she was excited about what you all have been doing. So please share with us, a little bit of your background for people who may be seeing you for the first time, and then jump right into what y'all have been doing in this new research.
Sure, and stop me at any time if there's any problems hearing or anything like that. So,
Mhm.
again, thank you, Dr. Swiner, for inviting me to be here. Thanks for all that you do in the community and nationally. you know, you're an outstanding leader in terms of health, but also in terms of entrepreneurship and publishing. And so I just want to also give you a plug for those who might be new to you. You're just so amazing and generous. And I love collaborating with you because I think it's a wonderful demonstration of how people can work together. We always say there's enough stars in the sky, there's the sun shines bright on everybody, and
That's
teamwork.
right.
That's what my colleague, Dr. Sharon Elliott Bynum, used to say. So we do that together, and it's a lovely thing. So my name is Dr. Cheryl Woods Giscombe. I am a faculty member at UNC Chapel Hill. I have to share good news that I was recently promoted to full professor. So
Congratulations.
I've been tenured since 2015, but the work and the support and encouragement from many people over all these years has paid off, and I got that great news. So it starts. I got the news, but it effectively starts August 1st. So I'm really excited.
Congratulations. Congratulations.
Parents and my husband for all the support. My sister, everyone who supported me.
UNC got it right. They got it right.
I'm just really grateful. I really am, because mostly it provides me an opportunity to mentor. One of my favorite things is mentoring. Just a little background. I am dually trained as a psychiatric nurse practitioner, as well as a social and health psychologist. I'm an alum of North Carolina Central University, North Carolina School of Science and Mathematics. So Bull City represent. I'm also an alum of UNC Chapel Hill. Was born here in Chapel Hill, but raised in Roxborough, North Carolina, and family all over the state and the country. But my dad's from Charlotte, my mom's from the Lake Gaston area, so I'm really committed to North Carolina. My research focuses on stress and health equity and mental health, and just really excited to talk to your group today about what we call Harmony, or the Harmony Study. It's an exciting project. It's a research project funded by the National Institutes of Health, specifically the National Institute for Minority Health and Health Disparities. And it's really a culmination of research that I've been doing since being a doctoral student, where we're focusing on, you know, what you mentioned before, reducing cardiovascular illness in African American women, and specifically reducing what we call cardiometabolic risk. So we're talking about heart health as well as preventing diabetes, and it stems from a previous project called We Can Prevent Diabetes that I conducted with my colleague, Dr. Susan Gaylord, and she and I are partnering again with an awesome team. Some of them may be on. I see Dr. Leslie Love is saying congratulations. She actually was part of the community engagement process that informed this Harmony study. Dr. Leslie Love, I'm glad that you're on and listening. But we are trying to reduce diabetes and heart disease and all of its affiliate illnesses in Black women and Black families. So if we start with the woman, of course, that's going to have a powerful impact on the family. And we really do want to encourage and invite people to consider our study. I'm going to go ahead and say it. If you're interested, when you hear me talk about Harmony, the email address is harmonystudy@unc.edu. Some of the team members might be on the call, Ms. Sierra Vines, Mr. Andrew. I don't know if Andrew's on the call, but Andrew, if you are, hello. And Dr. Susan Gaylord, Andrew Bradford and Susan Gaylord, and many others, including Carrie. So what we're doing is we're helping women become more educated about healthy eating, physical activity, and we're integrating social support in a very special way. So participants who are eligible for the study get to work for an entire year in group-based training with a personal trainer, as well as a nutrition expert, in addition to other support strategies to help women not only, you know, get healthier, but sustain that health. So we're really excited about this research project.
Excellent. I'm really, you know, I remember you talking about it kind of at the beginning when you all were recruiting, and just to see the excitement on Carrie's face when she talked about the training portion that she's been involved with, and the amount of great feedback you already have, you know, received from the study sounds incredible. Clearly, reducing stress, increasing exercise, getting all those things in order clearly will have a great effect on decreasing the rates of diabetes, hypertension, and then all the problems that come out of that. You know, what do you talk about with these women when it comes to their stress level? Like, how do you even address it? What types of things do you all talk about?
Well, the biggest part of this study is more so the physical activity and the nutrition components of,
Mhm.
and just thinking about how do women create healthy meals? How can women become more educated about calorie intake? And, you know, most of the people in our study are living in North Carolina or from North Carolina. So we know we have our Southern cuisine, and how do we make that healthier? How do we satisfy our family members when we're trying to be healthier? Sometimes that gets in the way. Um,
Right.
a question, is there a particular age group for the study? It's age 18 and up. So
Nice.
adult African American women, and the eligibility criteria is people must have a body mass index or BMI of over 25. So that means you're in the overweight category. And, you know, we have all of our different, and I know you can talk about this, Dr. Swanner, with your work in healthcare, but, you know, people may feel like, well, my body mass index, it might be over 25, but I'm okay. I'm happy with that. And this is not meant to make anybody feel like they it's not, no body shaming, no, none of that. It's about just eligibility in terms of starting early, right? NIH wanted us to say, you know what, and I'm sorry, this is a fact, but Black women in general have high risk, right? So
Mhm.
even if you love how you fit in your clothes, if you think about your family history, your moms, your father, your siblings, your grandparents, likely there's somebody in your family who have either some form of high blood pressure, heart disease, or diabetes. So
Yeah.
that in and of itself makes us at risk. So NIH didn't want us to create barriers to women, or unnecessary barriers to women being in this study. So
Mhm.
that's why we're starting young, 18 and up. And that's why, you know, you can just, you know, you don't have to be thinking that, oh, I'm already have heart disease, or, oh, I already have diabetes, and you're going to be in
Right.
this study. We want to try to reach people early so those changes can be helpful as early as possible, or even later in life. So I'm
That's
glad
right.
you asked. And no, you don't. So that's a good question. You don't have to be in North Carolina. I see the question in the chat because it's a virtual intervention study. However, there are 4 times during the study that you do have to come to North Carolina, because our assessments to determine eligibility, and then our follow-up assessments are in person. So we take lab values, we do body composition assessments, and those have to be done in person, because we do things like measure what we call our A1C, which is an indication of your glucose metabolism.
Hmm.
That requires a blood test. And we also look at things like inflammatory markers that are early indicators of risk. So those things do have to be done in person 4 times during the study: at baseline, which is before you even start the intervention, 4 months later, 8 months later, and 12 months. So if you want to drive to North Carolina for that, those assessments, feel free to do so, because the other aspects of the study are virtual.
Yeah. And you're still looking to recruit folks to be involved in the
Are
study? Okay.
recruiting people through 2024.
Oh,
So this is a
wow.
5-year study. We're on our first cohort now, and we have, if anybody's on my team, I think we have 9 cohorts to go. Or no, we have 7. We have 8 total cohorts. And this,
Okay. All right. You might be getting an email from me after that.
well, I'm
If
gonna
not,
send you flyers. I'm behind in that. I have them
listen.
here so you can put them up in your office and your clinic.
Yes.
Anyone
I
else
may,
wants to
yeah, I may
post
just sign
flyers?
myself up.
Yeah. Well, you're more than welcome. And you know,
Mhm.
if anyone else wants to, you know, either if you're interested in the study, or if you're part of an organization, a women's organization, a church, a community group, and you want more information about the study to share with people, you know, you can email us too at harmonystudy@unc.edu, because we can share our flyers, so you can share those with people you think may be interested in participating.
Excellent.
Now,
If one of, yeah, I'm sorry,
go
if one of
ahead.
your team members is still here in the chat, if you all can put the website and the email address so folks can see it, please do so. So I think that's incredible. So, you know, Carrie Green Scott is a friend, and you know, she's been transparent about also being my patient. but so I was her client and she's my patient. So we have a very, very interesting relationship. But she is an incredible personal trainer, knows a lot about nutrition. I mean,
He's wonderful.
she's wonderful. So if you're looking for a way to get so a lot of us, when it comes to trying to stay fit, eat right, and do all the right things, you're like, when do I have time? When do I have the money? Because personal trainers cost money, having a nutritionist costs money, trying to figure out the right meals and meal planning, all that costs money. Having a relationship with a mental health professional costs money. This is a phenomenal way and a wonderful way to have access to these phenomenal professionals. And the folks involved in the study, correct me if I'm wrong, are then reimbursed for their time. Is that not right?
Exactly. Thank you so much for reminding me of that. So
Yeah.
not only do you get to participate in the study and get to work with a personal trainer and a nutrition expert, you also get gifts. So, and I have to be careful because, when we work in research,
Yeah.
we have something called an institutional review board, and they make sure we don't try to coerce women to be in the
Right.
study. They make sure we just
I said it,
inform
not
people.
you. I said
Yes,
it.
but I can share, and it is on our flyers, that you do get gifts as part of being in the study, and incentives every time you come to the lab. Now, we hope that you participate in the study because you want to be in the study and participate in the whole thing, but we want to also let you know that we value your time
Yeah.
and your willingness to help us help our community. Because when people participate in research, you're not just helping yourself, you're helping other people who will benefit from this research for years and perhaps even generations to come. So we consider our participants collaborators and partners in this effort to improve health and reduce cardiovascular and diabetes related illness.
That's amazing. How many other studies historically do you know of that kind of focus on the types of things that you are focusing on, particularly for Black women? Are there any other ones like this?
There are other studies locally, perhaps. Definitely studies have been conducted. There was a major national study called the Diabetes Prevention Program, and that was a study with people who have pre-diabetes. My previous research was with people who have pre-diabetes. There are other weight loss studies that have been conducted with African American women. But one of the things that really motivated us to do this study is that research shows that if Black women are in studies, they are less likely to experience benefit. And if they do experience benefit, they're less likely to sustain the benefits
Hmm.
compared to other racial ethnic groups, specifically white or European American women. And
Hmm.
possibly it's because those studies and interventions were not developed to be what we call culturally relevant,
Right.
not developed to be in consideration of what's really priority for African American women, and what are some of the things we need to be sensitive about when trying to help them have healthier
Or maybe
lifestyles.
even because they weren't run by those that look like them.
That's possible, and that gets back to like what I was saying before about why I'm so excited about my work at UNC. I know UNC has been in the news, and I don't really want to go there for this Instagram.
Mhm.
What I will say is that as a faculty member at UNC, I have had the opportunity to mentor countless students of various racial ethnic backgrounds to be more sensitive to health equity, health disparities, and what it takes to provide health care to people from a variety of backgrounds. So I've worked with people from all backgrounds, geographic, racial ethnic groups, and in addition to that, I have been able to mentor people who are from underrepresented populations to get their master's degree, to get their doctoral degree.
Yeah.
I have numerous doctoral students who are from diverse groups, and it's really a gift to be able to mentor them and to guide them towards the finish line so they can be Dr. So and so they can do research to help the communities in the ways that they are destined to do so. So
That's
it's
right.
really, really great.
That's right. So we can continue having these opportunities by people that look like us, for people that look like us, and have that, have more consistency, more longevity with the good benefits. That's good. That's good. Well, again, I know the previous talks that we did, we talked a lot about the Superwoman schema, and even though the study that may not necessarily focus on that, can you just kind of run through those characteristics? I posted some of them on my Instagram, some of those main topics or main characteristics of the Superwoman schema. I love it so much. I want you to repeat them so people kind of know the brilliance that you came up with, that we all know and will sound very familiar, but to actually have it backed by research is a big deal. So please share with people what the schema is all about.
Yes, I'm more than happy to shift now from talking about the Harmony study, but I did go ahead and put that in the chat for people.
Good.
They want information about our email. So,
yes.
Like Dr. Swanner is discussing, there are a lot of other projects that I've been working on as a researcher, as a psychiatric mental health nurse practitioner, and a social and health psychologist. And one of the things that I'm interested in is emotional well-being and stress and coping. And that's something I've been interested in since I was probably 14 or years old and maybe younger. And so one thing I noticed was that when we study stress and its effects on health, when researchers were doing that, they were measuring stress in a way that we call generic. They're generically measuring stress, and all of us have stress. Part of the human experience is having stress.
Yeah.
But consider stress in African American women, for example. What about being a Black woman influences how we experience stress? Is there something about being Black that influences the way we experience stress? There's something about being a woman, and the answer is yes and yes. Our research shows that, and other colleagues have done work too. And just through the course of numerous studies, developed a conceptual framework called Superwoman Schema, and that is actually what we have in common. Dr. Swanner and I are both interested in this phenomenon related to strength, and many other people call it the strong Black woman role, the strong Black woman complex. We both call it Superwoman, which is really something. I think that we both chose that term, and I know we each have our reasons. And so the Superwoman schema involves 5 characteristics, at least through my research, and it includes, can you see me okay? Okay.
Yes.
1, an obligation to present an image of strength. 2, a perceived obligation to suppress emotions. 3, a perceived obligation to resist being vulnerable or to not accept help from others. The 4th one is a motivation to succeed despite limited resources. And the 5th is prioritization of caregiving over self-care. So women are known to be the backbone in the community. They may be serving their families, their friends, their communities. They're on the usher board, they're in the choir, they're in their sororities, they're at work. And so they're doing those things because they're trying to support the needs of children or elders or then community at large. But then that might mean they're putting themselves on the back burner. So those 5 characteristics make up what I call Superwoman schema. Mm-hmm. And we know that it's a really interesting thing for us to consider when we're considering the overall health and well-being of Black women.
That's right.
Can I ask you a question, Dr. Swanner?
Yes.
So what made you start doing your work on Superwoman Complex? Because I think it's great for people to hear that too.
Yeah, so you've heard me talk about my my rock bottom moment, my literally hitting the floor moment was coming into practice fresh out of residency. I'm a Dookie, but went to UNC for residency, but then, right after finishing residency, went straight into the workforce, and then, was working as a green physician, got married, had my first kid, became a business owner. It was like boom, 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 right? So all the good things, good stress, right? Good things, good stress. But all those things happen kind of back to back to back. You're working, you're moving, you're having the baby, you're breastfeeding, you're not eating, not sleeping right, you're not drinking enough water, all the things that we think we're supposed to be doing because we are, successful women and we are the first in the family, right? We are supposed to be successful, supposed to do all these things and not complain about it. And literally coming back after maternity leave for my first baby, hit the floor, passed out. You know, so my rock bottom moment literally brought me to terms, and I had to look myself, you know, and look at my life and my routine and my schedule and figure out, we can't do this. Like, I can't hit
Right.
the floor multiple times. What are we going to do to change that? And thankfully, the men in my life, the two main men in my life, my husband and my father, were the ones who
Wow.
told me about, you don't have to be strong all the time. You don't have to do everything all the time. We know that you're capable. We know that you're willing, but we do not want you literally to work yourself to death. We have to figure this out. And that's how I started reading and researching. My father actually gave me an article about women in the workplace. It was a Newsweek magazine article, and it referred to the Superwoman as this thing. And then I went and found, you know, the book written in 1984. And I always, every time I try to talk about it, I want to make sure I get it right. I think it's Dr. Shakowitz
Wow.
that
Was
wrote
that the
it.
second shift or the third shift? What was that? What book was that?
It's the Superwoman. I'm going to get it wrong. I don't want to get it wrong, but there's a book from 1984 that talked about kind of the first bits of research being done on this thing called the Superwoman syndrome, where women were in the 1960s, 1950s, still at home, barefoot and pregnant, but entering the workspace, becoming CEOs, doing these wonderful things, but also still having to raise the family and be everything at home, and how mental health issues, how emotional health issues, how physical health issues, how substance abuse issues were on the rise in the 1980s. And then, you know, so I clearly, this, you know, light bulbs went off, and I said, this is what's happening. This is particularly for Black women. This is why I'm seeing all these patients in clinic that look like me, have backgrounds like me, but our blood pressure's too high, our weight is uncontrolled, we're not sleeping, we're not exercising, and we're not taking great care of ourselves, and we're dying earlier. And I don't want to be in that number. So I want to focus on self-care. I want to focus on me time, and then I want to preach and teach it to others so that they have permission to also do so. And so that's where it came from.
That's what a loving father you have, first of all. What a loving father and loving husband,
Yeah, thank God for them.
and that's
Because I know not everyone has that
yeah,
support,
but
right?
it takes support in some form, right? And for you to do all the wonderful things you're doing, I refer people to you as well. So thanks for having me on this platform to help me recruit people for the study. But I refer to you, refer people to your practice also because
Thank you.
everything in one. You have someone who's trained at institutions that train you properly, but then to have someone who has this level of compassion and understanding and
Yeah,
willingness to appreciate all that a woman or a person brings to a medical encounter, you can't find that all the time. So
yeah,
when
yeah.
people say, oh, I'm looking for someone, I don't hesitate because I know they're going to be in good hands.
Thank you. I appreciate that. And then, even if I'm not available when they're available, you can reach out to us at Durham Family Medicine. We have other wonderful providers also available. And, I try to put that into the environment, the culture of the practice.
Yeah.
And so I try to make sure that everyone is focusing on good self-care, good mental health, wholeness, not just, putting people on medicines for the perfect numbers, but making sure they're taking time off, making sure they're exercising, making sure they're getting their massages, which I'm
Yeah.
about to go do in a minute.
Oh, so awesome.
Right? So, really, really focusing on what makes them most happy, most joyful, and then hopefully the folks around you, your people around you will also feel that. If you're miserable and broken down and, falling apart, you're no good to anybody else, right?
Yeah.
So,
That's
yeah,
Thank you so much, Dr. Schweiner.
you are welcome. I did not want to keep you for too long. I know you're very busy. She said, so Neva right now. Yeah, go get that
That's
massage
Leslie
right.
Love. She's amazing. She's a food artist. How do I call you, Leslie? She's
Ooh,
a chef, Chef Leslie Love, and she does so many other things. But
excellent.
she's been a great colleague for a number of years. Yeah.
Excellent. Yeah, so thank y'all so much. Dr. Cheryl, please again repeat how people can follow you and get in touch with you about the study.
Okay, I will say one more time, we're at the Harmony Study at unc.edu. Harmony Study at unc.edu. But if you Google my name and find my email address, cheryl.giscombe at unc.edu, I'll be happy to put you in the great hands of my study team, and they can take care of you. You will be well taken care of. We have an awesome, awesome team of people who care. They get it. You're going to feel great being part of the study.
Excellent. And you guys, please thank you for coming, and please share with your folks. Let them know about the study. Let them know about what Dr. Cheryl is doing. Follow me here at Real Doc Swiner. This is my new IG page. I really appreciate you all supporting. And get ready, by the way, talking about the ultimate self-care experience. What I'm planning on for February is to take my folks for New Year, New You to Cabo
I saw
in
that
Mexico.
online.
And so actually, by the way, as you were talking, Dr. Cheryl, I may have something for you. I'm gonna talk to you about some stuff.
Okay.
But we're going to Cabo in February. Get your vaccines, get your COVID tests, get your
Yeah.
passports. Let's go and have some good fun, some self-care, some relaxation, some refocusing. We're going in February 22, and the website is bit.ly/NYNY Cabo for New Year Cabo, and I'm really excited about it. So let's have some fun. All
Awesome.
right.
Enjoy your much deserved massage.
Yes. Yes. All right, guys.
Good
Thank you
night,
so much for joining
everybody.
us.
Thank
We'll see
you.
you. Bye.
Okay, bye bye.